Well, lung cancer is the world's leading cause of cancer death, affecting more people than colon, breast, and prostate cancers combined. Dr. Richard Schrader is a medical oncologist at the Cancer Institute of St. Joseph Medical Center, and he joins us now. Thank you so much for being with us. So I know there are things that you can do to help lessen your chances of getting lung cancer or at least spot it early. When is it the most treatable? And let's start when we're talking about smoking.
Just start off simple. If you don't smoke, don't start. And if you do, we want you to work on quitting. Smoking is the leading cause of preventable deaths. And in fact, 80 to 85% of lung cancers are due to smoking. Male smokers are 23 times more likely to be diagnosed with lung cancer than non-smokers.
And what about vaping? Kids may think that it's less dangerous than smoking, but not necessarily the case.
We are still encouraging people not to vape. We don't know from the standpoint of cancer whether it's any less likely to cause cancer. And there's also the concern of acute lung injury from the hot vapor.
And should we be worried about toxins in our homes like radon?
We should worry about radon. It's estimated that about 1 in 15 homes will have high levels of radon. Radon is actually a colorless, odorless gas that is released from the soil and the rock and can accumulate in houses, especially in old basements.
And you recommend that your patients get some fresh air, right?
We recommend that patients get fresh air, that they avoid prolonged exposures to secondhand smoke, to obviously any chemicals or fumes, and just in general getting outside and eating healthy and exercise, socially distanced, of course.
Is family history a factor?
Family history is a factor, and in patients who have a first-degree relative, they are at increased risk for lung cancer, but it is not quite as strongly associated or understood as some other cancers, say breast cancer, ovarian cancer.
And what are the symptoms that we should be looking out for?
The symptoms with lung cancer can be due to the cancer itself in the lung, which would include an increased cough or persistent cough, change in character of cough, hoarseness. Certainly would be a big concern if you see any blood in your sputum. The other thing can be if unfortunately the cancer spreads and affects other places. So if people have new or chronic headaches or back or bone pain that is different or new and persistent, or unintentional weight loss.
And are there screenings for lung cancer?
There are screenings for lung cancer. There's a low-dose CT scan that is recommended by the United States Preventive Task Services Force for patients aged 55 to 80 who have a 30-pack year history or more of smoking and are currently smoking or have quit smoking within 15 years.
And what is the best treatment right now?
It's important to realize that a one-size-fits-all doesn't work for all lung cancer patients. Here at the University of Maryland, St. Joseph Medical Center, we take the approach of deciding together as a multidisciplinary team which approach is best. So sometimes that can be surgery, sometimes that can be radiation oncology, radiation, whether that be traditional radiation or stereotactic radiosurgery, or medications. And those medications can be traditional chemotherapy, molecularly targeted therapy based on the tumor expression, or immunotherapy. We also do have a palliative care team here, which can be very important in more advanced cases.
Dr. Schrader, thank you so much for being with us. And for healthy diet and lifestyle tips for cancer prevention and survivorship, you can download your free Healthy Living Guide at umstjoseph.org/WMAR. We'll be right back with more Midday Maryland right after this. Stay tuned.